Hi, I'm Sue Cressley, Medical Director of OP, and let's take a closer look at the independent historian. According to the AMA, the definition of an independent historian is an individual, could be a parent, guardian, surrogate, whoever provides a history that's in addition to a history provided by the patient, and the patient is unable to provide a complete or reliable history. For pediatricians, this is mostly due to age, but it could be due to developmental stage, dementia, psychosis, or just because the provider believes they need a confirmatory history in order to make appropriate medical decisions. In the case where there's multiple historians needed, you can only count this once, meaning the independent historian requirement requires one additional person other than the patient. So where does this matter? Well, it matters when choosing an E&M office visit based on medical decision-making in the data reviewed category. Having an independent historian automatically gets you to at least a level 3 visit, and that's a win for pediatricians. In order to get to a level 4 visit or moderate based on data reviewed, it gets you 1 out of the 3 countable elements needed in category 1. You still need an additional 2 elements to fulfill that category, and that can be from any combination of tests ordered, tests reviewed, or a review of external notes. For a level 5 visit or a high visit, it gets you 1 out of the 3 countable elements that we talked about above, but you still need to fulfill the category 1. In addition, you also need to meet one of the other categories so that you have met the criteria in at least 2 out of the 3 criteria, 2 out of the 3 categories. How does OP help? Well, we make it easy to document an independent historian was used in order to drive coding level decision support. And in the dropdown, we allow you to put in either a role, the mother, or if it's a patient who has contacts on the contact table, the names of those people who are associated with that patient will be there available in dropdown, or you simply can type if it's a maternal aunt or someone who happens to be bringing the child today. But by documenting in that field, OP will count it and make sure you get credit for it in our coding decision support. So after you fill in that field, when you go to coding decision support, you will notice that the assessment requiring an independent historian is yes, which gives you a data reviewed limited or a level 3 visit just because you used the independent historian. So is that enough documentation? Well, I always say when in doubt, spell it out. You never know what auditors are going to want. And for infants, it may be enough to fill in that field because an infant is not capable of giving their own history. However, for older children who may be capable of being their own historian, it's likely best to document something in the note that supported your coding choice, such as mother reports no family history of recurrent otitis requiring tubes or hearing impairment. You wouldn't expect a child to know that family history, and so the mother was required to have and provide that additional information as an independent historian. Thanks for listening and happy coding.